Welcome to Wonder Hair Career Institute Online. My name is Livina and I'll be your instructor for today. And today we are going to talk about food care. On the day of your exam, you will have your instruction card that reads like this. You are asked to provide food care to a resident. Soap and water is used and food care is provided to only one food. The resident is sitting in a chair. The resident's socks and shoes are replaced at the end of the skill. This skill is live person skill. It's not mannequin skill. So you'll be doing food care on one of the students that is there taking the exam on that day too. We'll start from the checklist number 3. Remember your indirect skill care, greeting your patients. Those ones we are not gonna say it. We have already thought about it several times. So I'm going to start on skill checklist number 3. Place water, fill basin on protective barrier on floor to prepare for food care. Remember, if you are doing skills while the patient is in bed, remember you have your barrier on the overbed table. Now this one is on the floor, so you still need barrier on the floor, and that's why you have to put your basin filled with water. Use water of safe temperature for soaking food. You have to make sure you check that water when you get in it and allow the patient to check the temperature of the water before you soak the person's food in that water. Soak resident food in basin of water. Use soapy washcloths to wash food without adding soap directly to basin of water. When you soak the patient's feet, you want to make sure you bring that feet out so that you will wash that person's foot on a towel that you set aside on that barrier. Wash top and bottom of foot and between toes. Remove soap from foot, including between toes. When you are washing, you want to make sure you wash the top, the bottom, and wash in between toes. You make sure you remove soap from where you wash. Dry entire top and bottom of foot, including between toes. Warm lotion before applying to foot. How do you warm lotion? Warming in hands. Okay, you put soap in your palm and then warm it up before you apply it on the patient's foot. Apply lotion to top and bottom of foot, excluding between toes. When you're washing, you wash in between toes. Rinse in between toes, dry them, then you don't apply lotion in between toes. Remove visible excess lotion from foot if present after applying. Apply sock to foot, leaving socks smooth, and replace shoe, leaving any fastener such as ties. Provide support to lower extremity throughout procedure as needed to avoid strain. Complete skill, having rinse, dry, store basin, place linen, soil linen in hamper, and disposing of trash. If you read this, you will know there are points that's mentioned in this checklist. 1. You have to put barrier on the floor. Your basin of water should not be on floor without barrier. It must be on top of barrier. Remember your supplies. You have to bring towel, put a towel on those barriers. Soak the food in the water, but don't apply soap directly. You bring this food out, wash it. When you are rinsing, that's when you put the food back in the water and rinse them. You want to wash on top, bottom, in between toes. You rinse as you wash. You dry places that you have washed. Critical elements in this skill is that you should not apply lotion in between toes. Now we have to go over some questions, likely questions that you might get in your exams. When you keep doing your food care, remember we say you have to check the temperature of the water. You are doing pericare, you check the temperature of the water. You do neck care, anytime you are using water for your skill, you must check the temperature. Now, it is most important for the nurse aide to check the temperature of water before assisting the resident with mat care, soaking the resident's feet for food care, giving the resident a bed bath, and washing hands. Which one is most important? Soaking the resident's feet for food care. Remember, most of our patients are elderly, and as we get old, we lose some sensitivity on the nerve endings in our skin. That is one. Secondly, most of these elderly, some of them might have diabetes, and they might not feel that hotness of the water the same way you will feel it. And if you don't check that water and the patient check it also, you might burn that patient with hot water. And if that happens, the wound is very, very difficult to heal. Another question. A resident must stay in bed is at risk for developing which of the following? Dementia, arthritis, foot drop, Parkinson's disease. Foot drop. If somebody stay in bed for too long, the person might develop foot drop. And what is foot drop? Foot drop is difficulty lifting the front part of the foot due to what? Weakness or paralysis. And we prevent this by having a footboard for those patients. Question number 3. When bathing a resident, the nurse aide observes that the resident's great toe is red and swollen. Which of the following is the appropriate action by the nurse aide? A. Protect the toe by putting on an extra sock. Report the observation to the charge nurse. Apply an antibiotic ointment to prevent infection. Soak the foot in very warm water and dry gently. The answer is report the observation to the nurse. If you are protecting the patient's toe by giving extra sock and you didn't tell the nurse, what do you think that will happen? There might be complications. Applying antibiotic, are you a nurse? And why should you soak the feet in a very warm water without instruction? The answer is B. Report the observation to the nurse. Why is it important to check the feet of a resident with diabetes at least once a day? A. To look for sores on the feet the resident may not feel. B. To check if vision problems have resulted in foot injuries. To trim the toenails so they do not become long or jagged. To make sure the resident does not get a foot fungus. If you listen to what I said earlier, people with diabetes might not feel the pain on their feet. So when they have injuries on their feet, they might not tell you because they are not feeling it. So that's why we have to check it to make sure there is nothing bothering them on that area. We want to make sure there is no injury. Another question: when the CNA washes a resident feet, the water temperature should be hot, cold, warm. It has to be, lukewarm. I guess you're not gonna use hot water or cold. Which of these statements regarding nail care is false? Nail care: dry the resident hands and feet after soaking. Report any breaks in the skin to the nurse. Soak hands and feet at a safe temperature. Rub lotion between the toes to prevent skin from breaking. Which of these is false? The answer to this question is D. You don't want to rub lotion in between the toes. I hope you enjoyed these little tips. And if you do, please subscribe and hit the notification button. Good luck in your exam. Thank you.